Hello, I am Dr. Sheetal Chaurasia, consultant pulmonologist in Manipal Hospital Whitefield. Asthma is a chronic inflammatory disorder of the lower airways. It affects nearly 400 million people worldwide. Nearly 3 to 10% of people suffering from asthma can be classified as having severe asthma. Asthma is a heterogeneous disease with a considerable variability noted in the control of asthma as well as the presentation of asthma. Patients whose asthma remain poorly controlled despite high dose inhaled corticosteroid or who continues to have repeated exacerbation while on treatment with high dose inhaled corticosteroids and have their modifiable risk factors addressed are considered to be having severe asthma. There are many causes of severe asthma. One of the most important causes of severe asthma remains the lack of response of existing treatment to the pattern of inflammation in the airway. The pattern of inflammation in the airways are generally divided into two types in asthmatic patients. T2 high and T2 low inflammation. In a T2 high inflammation, there are certain cytokines like IL-4, IL-5 and IL-13 involved in the pattern of inflammation. The differentiation of these two patterns of inflammation is important because certain markers of inflammation can be targeted, and that is the basis of the targeted or the precision therapy in asthma. A landmark development in treatment of asthma has been the availability of many biologics in the treatment of asthma. Biologics are monoclonal antibodies which binds to specific determinants of asthma pathogenesis like cytokines and certain receptors which are involved in the inflammation of airways in asthma patients. There are 5 biologics available which are FDA approved for treatment of asthma. In India, we have 3 biologics which are available for treatment. As the name suggests, targeted therapies are to be tailored for a very specific population group in asthma patients. Eligibility of a patient for these medicines has to be assessed by a trained pulmonologist who has experience in treating such patients. Clinically speaking, severely symptomatic patients who remain symptomatic or have repeated exacerbation despite having been on high dose inhaled corticosteroids and other modifiable risk factors have been addressed can be considered for these precision medicines if they show evidence of T2 high inflammatory pathway like high eosinophil counts, high IgE counts, and after assessing for other risk factors and ruling out contraindications, these patients can be started on treatment with these biologicals under care of a pulmonologist or someone trained in prescribing these medicines.